Let's get moving. Good morning, everybody. Welcome to the third and final installation of CoveCare Center's Recovery is Happening webinar series. We're really excited to be here. These webinars were really an effort to make sure, had a variety of purposes. Really, one was to just to make sure that the community understood and knew what it was that we've been doing here at CoveCare Center generally and during the pandemic. We've had a webinar to do with kids services, a webinar and services for kids and families, as well as just general behavioral health services, our mental health clinic, substance use clinic. All those videos will be available for streaming online, so you'll be able to see those webinars if you missed them the first time they came around. This webinar actually was born out of an in-person training that Krista and I had developed, intended to happen in the middle of March. For obvious reasons, that didn't happen. We think that it's actually extremely apropos to what's happening now in the world. So once we get into it, you'll see what it means by that. But really the theme here is to talk about business. CoveCare is a local not-for-profit business. We partner with a lot of our local chambers of commerce, and we know we have some attendees through those groups this morning. So we're really excited to offer this resource to the community. And in addition, we're an organization, like I said, we're a not-for-profit organization. We're raising funds, we're raising awareness. We have some really excellent sponsors to this webinar series, and whose names are, my hands disappear when I do this, but they're sort of surrounding my head here. We also have a short video from one of our sponsors that I'm going to share with you all now. Excellent. So we thank the South Putnam Animal Hospital for their support and for that video. It just reminds us, how important pets can be during a time of strife and challenge. And here we are.
That video.
A lot of people at home, we love it, right? They've been strong supporters of ours, as are all the other sponsors who are, again, surrounding my head on the screen here. So why don't I pull up our PowerPoint, and we can get started here. Okay, so before we actually get really started here, I'll just introduce myself, which I haven't done yet. My name's Eric Toth. I'm the CEO at CoveCare Center. I've been with the agency about 2 years and have about a 20-year experience working in behavioral health with kids, families, adults, seniors, veterans, a wide range of services. Krista, do you want to tell us about yourself?
I'm Krista Zanfardino. I'm the Associate Vice President. I've been with the agency next week 16 years, quite a long time. I've been lucky enough to work in lots of different departments in care management, in our PROS program, and I primarily do work on our data and EHR, some analytics, and some interesting program development.
And for those of you who don't know the acronyms that us in our field speak about, EHR stands for Electronic Health Record. It's the alphabet soup of behavioral health. So, okay, so the title of this presentation has to do with the fact that behavioral health impacts businesses, right? And so what we really want to do is make sure that we present to our audience how behavioral health how to see it, how to recognize when there's issues, how it can affect things financially, and kind of like what should you do. So we're going to offer a brief introduction to what is behavioral health. For Krista and I, we're in this field. We talk about this regularly. We know what we mean when we say these things, but we want to sort of have a level set to make sure that everyone kind of knows what it is that we're talking about here when we talk about behavioral health. We're going to talk a little bit about the impacts of behavioral health issues in the workplace and in the business environment more broadly, what to look for, how it's impacting things, that type of thing. And then we're going to talk a little bit about what kind of help is available and how, as a business owner or a manager or an HR professional or whatever, how you can support your employees best.
So what is behavioral health? When we're talking about behavioral health, we're talking about more than just traditional mental health. We're talking about resilience. We're talking about wellness. We're talking about how we think, our thoughts, behaviors, actions. Behavioral health focuses on treating people from a whole person perspective, and including in that is mental health and substance use. So we work with people from a whole person perspective. It's more than just the individual. We're in helping people in recovery. We talk about their supports, their families, employers, coworkers, communities, and of course, in working with the whole person, behavioral health is linked to the person's physical health. There are many medical issues that exacerbate mental health. I'm sure you all have experienced when you're not feeling well physically, it's hard to be well, mentally also.
Okay, so just to offer kind of a framework upon which we want all of this presentation to rest, sort of some things. Again, this is a little bit of a level set kind of slide here. This is just setting a platform here of things that we're all going to kind of agree to on for what we're talking about here this morning. So the first is that we can understand and acknowledge that there are social costs to a decline in behavioral health, right? What I mean by that is that these, when someone's having a decline or challenges to their behavioral health, whether it's mental health, substance use, or a combination of those things, it impacts people socially. It impacts their family. It impacts their friendships. It can impact their business or their workplace if they're, if they're not the business owner. And it therefore impacts communities, right? So these are things that we are just going to agree to that this is the case. The second thing is that a decline in behavioral health can affect anyone, right? No one is immune from mental health challenges. No one is immune from the risk of substance use challenges. It doesn't matter if you're fully employed, have a happy, healthy, and supportive family. These issues can still impact you, regardless of whether or not you've been very lucky and privileged in your life, or whether you've been dealt a hand that gave you many challenges. And the third thing is that we're going to agree that these are things that we shouldn't be ignoring. There may have been a time when people said, just ignore it, it'll get better, or just deal with it, it'll get better, and don't talk about it. But I think we can all agree that that's not the correct approach. These things don't just go away. They need addressing. And part of what we want to do here this morning is to make sure that in ignoring these things, we stigmatize them. And part of our mission at CoveCare Center is to reduce that stigma around behavioral health challenges. Again, if you talk about bullet number 2 here, if this can affect everyone, then we shouldn't be stigmatizing the fact that these things are happening to us, or people who we care about, or people who we work with, our friends, families, business partners, customers, anything like that. We can't ignore these things and hope that they go away. They need to be talked about. They need to be aired out. They need to be addressed. Okay, so we're going to frame the issue here just around sort of mental health broadly, just to give people a sense. And it's worthwhile to note that while we're talking here this morning in the midst of a pandemic that we've all been dealing with in some fashion since February and really March, for months and months and months, that all this data that we have here is data from more or less before COVID, right? So we know that there's been impacts on people's behavioral health and functioning since March, since all this started happening. So even as this data might seem to show really high numbers, the fact of the matter is that these things have probably deteriorated overall across the country. So according to the National Association for Mental Illness, 60% of adults with a mental illness don't receive mental health services and hadn't received mental health services in the previous year. So going back to the previous agreement that we had to agree that these aren't things that we should ignore, doesn't necessarily mean that not getting services means that they were being ignored, but it does show that people weren't getting the treatment that they need. Despite the fact that depression is actually the leading cause of disability worldwide, we still have a huge percentage of people not getting the services they need. In the United States alone, serious mental illness costs almost $200 billion in lost earnings every year. So that's people who aren't able to work, who aren't able to participate in the workforce as a result of having serious mental illness. And that 90% of those who die by suicide have an underlying mental illness. And we all know that suicide has huge social costs to families and communities and social groups. That kind of loss for people is very, very challenging to get through. Okay.
So when we're framing the issue, Eric was just talking about mental health. We also have to frame the issue in the terms of substance use. You know, especially we're going to talk about opioid use, opioid dependence throughout this. And in the past few years, we've heard more and more about the opioid use epidemic. And as opioid dependence increases and opioid overdoses increase, this obviously has a huge impact on your employers and people in the workforce. You know, there are 113 million adults working. And when we think about 10% of those people have a substance use diagnosis, that's significant. That's 10 million people right now who are working who have a substance use diagnosis. And even if you just think about 10% of your employees may have a substance use diagnosis and be struggling with substance use issues. And unfortunately, a lot of people are not getting help and are not in treatment. And we'll talk about that. And we'll talk about the stigma that people experience and the fear of treatment and the fear of retribution of going to treatment. And the importance of supporting your employees so that they can get into treatment. So caregivers and the people who support people who have a substance use issue also lose out on days of work and lose out on productivity because they have to stay home or they have to take care of their loved ones. So it's not just people who themselves are struggling with use, it's also the people who are caring for the people who are using.
Just to add to what Krista is saying, right? So this first big pie here of employed full-time people, again, these are pre-COVID numbers, so we know that that pie has gotten smaller. What we do also know that therefore the employed part-time people have gone up, or up or down regardless, but unemployed has gone up, and not in the labor force. A lot of people, as a result of having to care for children and for other reasons, have left the labor force in the last 9 months. As you can see, the percentages for particularly of unemployed people who are struggling with substance use issues is a lot higher. So if the number of unemployed people have gone up, then in all likelihood, the number of unemployed people who are struggling with substance use has also gone up. So you can see that these numbers have probably been very negatively impacted by the current situation.
So this diagram is just to emphasize how many people who have a mental health diagnosis also have a substance abuse diagnosis. And so in our world, we call that co-occurring, and that's people who have diagnoses in more than kind of one area of behavioral health. But we really wanted to emphasize the importance, the statistics of, you know, we have here 8.5 million people have a co-occurring diagnosis of both mental health and substance use, and the importance of helping people get into some sort of treatment. Now, as Eric said, these numbers were pulled together before COVID. So just to paint the picture of how big, this was to paint the picture of how big this was before isolation. Imagine now the struggles that people are facing, having employment issues, whether they're unemployed or underemployed. So maybe they're working part-time. They used to be full-time and now they're part-time. A lot of restaurants, a lot of stores that are now not able to keep people on full-time, and how that can affect somebody's mental health and substance use.
Right. And to your earlier point, when we talk about behavioral health and specifically the way we work with people at CoveCare centers to treat the whole person. So we don't just treat someone just to do with the issue, but we treat the whole range of challenges that they might come to us with, and as well as the whole range of strengths and capabilities that they come to us with. And this is just to show that we're not just serving your sort of mental health people here, people with substance use issues here, but that we're serving people who may come to us with a variety of challenges. So the prevalence of behavioral health issues in our employees, right? So according to one study, close to 20% of employed Americans, from mid-adolescence to mid-50s, report experiencing mental health symptoms in the previous month. So this is talking about basically 1 out of 5 employees, before COVID will report symptoms of serious mental health challenges in the previous month. And that only 37% of workers see the leaders in their organizations as people who are advocates for mental health at work. And this is a huge, and that 80% of them actually feel that there's a stigma to receiving treatment. We talked earlier about the number of people who don't receive treatment typically in the course of a year, 60%, right? So if you work in a place where you feel like bringing up social, your issues to do with mental health or substance use would be stigmatized, or that seeking support or needing time off to support a family member who might be struggling with some of these issues, even if it's not your own thing that you're coping with yourself. If it's stigmatizing to bring it up in the workplace, then you're less likely to get treatment. And we're going to talk more about what it looks like for businesses when people are not getting the treatment that they need and when they're bringing these challenges to work, because we are all people and our personal life does come with us into the workplace, regardless of what kind of work we do. So it's very significant and we'll talk later about what you can do as an employer, but having a social environment in the workplace where these things are stigmatized can have very real impacts, not just for your employees and their families, but also for your business. So we've already talked about this. Because of stigma, because of economics, health disorders can go unrecognized, untreated, and ultimately that can reduce in people having lower productivity at work. Right? And we'll talk a bit about what that means. But these costs to employers, the costs of mental health challenges at work, actually have been shown to exceed the company's spending on health insurance and pharmacy expenses, right? So if you're an employer, you're a manager, you know that there's costs that your business has to provide healthcare to your employees. What you might not realize is that you may be paying out of your bottom line even more than that because of the impacts of behavioral health on your employees' productivity. Hopefully that's clear. Like Krista said earlier, if you have questions, please fire them off in the Q&A. We may not get to them until closer to the end, but please, if something that we're saying, doesn't resonate, or if you want us to talk more about it, we'd be happy to.
So of course, we can't talk about behavioral health without addressing COVID. Now, this is not a COVID presentation, but we have to talk about COVID. The stress of keeping oneself safe and healthy, keeping your family safe and healthy definitely impacts a person's, mental wellness. And, think back to, I don't know, about just like 5 months ago when we were stressed about getting cleaning supplies and toilet paper and just being able to get basic needs into your own home. And when I think about COVID, I just think about like that terrifying stress, and how does that affect people working? And then you have to go to work every day or sit at home every day. I know some of those things have gotten better. I know that we're able to get some supplies that, we need, but, the grocery stores are not fully, stocked, and people are worried about second waves and third waves. And that's just constantly on your mind. And that's all of that stress of just taking care of yourself, taking care of your family. That's before we even talk about the financial stressors for employees or employers. If you're a business owner, on top of having to worry about yourself and your family, now you have the stress of worrying about your employees and your business, and having enough PPE and having enough, one way up this aisle and down this aisle, and just kind of keeping your customers safe. And so stress exacerbates, underlying mental health and substance use issues. And that's very important. And we're going to see more and more of people who are really struggling with their substance use and their mental health because of the stress of COVID. Some of us were lucky enough to be able to work from home, which is a blessing. I know I'm grateful for it. But that comes with its own stressors. That comes with the stressors of, do you have a space to work? I know personally for myself, I spent the first 4 months of working from home in my bedroom, and I didn't, and I have a small room and I didn't have a chair in there. So I was working on my bed every day, and that just doesn't feel good. And that's not good for my sleep, and that's not good for my health. And I'm not up and moving around as much as I would be in the office, and I'm not seeing my coworkers and the camaraderie of working with other people, on top of the stress of new technologies. If you haven't had to use a computer, you haven't had to learn Zoom and Teams and all of these new technologies, that can be very stressful for people. And technology alone can cause people to not be able to get their work done. So we have to talk about the risk of people being isolated and being lonely and not feeling like they're unable to do their job anymore, and the depression that can lead to.
So we're going to shift into talking a little bit more about some sort of financial metrics here, right? So the World Health Organization basically estimates that depression and anxiety cost the global economy $1 trillion per year in lost productivity, right? Which is a huge number. And just to put in perspective, that's a little over 1%, about 1.25% of the world's economy. Again, these numbers will be thrown off by what's happened over the last 9 or 10 months. But to put it in perspective, that these ideas of depression and anxiety have such a huge impact on the global economy. And there's, statistically, it's shown that for every $1 put into scaling up treatment for depression and anxiety, behavioral health generally, there's a $4 return in improved health and productivity, which is money well spent. There's not many other places where you can invest $1 and get $4 back. That's a pretty good return. So translating those numbers into Putnam County, we can say based on these sort of averages to the world and what Krista already mentioned about the opioid epidemic and the people who are not in the workforce due to the opioid epidemic, that the value of lost productivity, as we would relate it to the sort of gross economic output for the county due to depression and anxiety, is in the range of $80 to $100 million just in Putnam County. And that 1,500 Putnam residents would not be, based on New York statistics, sort of generalized to Putnam, that 1,500 Putnam residents are not in the labor force directly as a result of the opioid epidemic, which is a pretty huge number if you think about it. And this was me conservatively estimating based on the data available to me, again, before COVID, which has certainly not helped the opioid epidemic. And a conservative estimate of the lost earnings for these 1,500 Putnam residents is about $64 million. That's $64 million that's not being made by people who live in this county who would want to spend their money and would need to spend their money on supplies, services, and goods from your businesses as local in the local Putnam County.
So we're going to go into a bit of specifics about some mental health and substance use. And we're not talking about this to teach you guys how to diagnose mental health and substance use in your employers. We're not asking you, employees, we're not asking you to, have them lay on a couch and, become Freud or anything like that. We're just trying to educate you so that you may be able to recognize that somebody might want to be encouraged to speak to HR or just to recognize that somebody may be going through things. I think often people who don't understand mental health may label people as maybe disorganized, uninterested, and not a team player, and not really understand that somebody could be struggling with depression or anxiety, which are the ones that we're really going to focus on. So we have been saying depression a lot, and that's because depression is the leading cause of disability worldwide. And it's ranked first as the costliest health condition. And there's a lot of reasons for that. Along with depression comes some physical health issues, and people who are not in treatment may have costlier down the line, who suffer from depression for years and years. People don't really feel good about going to treatment unless they're supported by others. Workers with untreated depression lose about 27 work days per year. That's a lot when you're between, sick days and loss of productivity. And when with 57% of people who are diagnosed with depression are receiving treatment. That's a lot of people not receiving treatment. So when you think about only 57% of people are receiving treatment and they're losing 27 work days, imagine how many work days that people who are not in treatment are losing. And when we ask people why they don't receive treatment, they state that they don't have time, they can't afford it, they're concerned about people knowing that they're in therapy. And we really want people to understand that the more as employers you could do to reduce the stigma, then we can make it easier for people to access treatment. The more successful people will be personally and professionally. So some of the things you might see in depression, these are not just all of the symptoms of depression. We just kind of wanted to point out a few things. People may be a little bit withdrawn. Maybe they're not making good eye contact. Maybe they're a little bit more irritable or fatigued. Often people who have depression are exhausted all the time. It takes a lot of effort even to show up. Now, these are, of course, just some of the things that you may see. There's other symptoms and other, this is not to diagnose somebody, but it's just if somebody is all of a sudden, you're noticing them a little bit more restless or a little bit more irritable, or you had an employee who used to be really a good producer is not able to produce, you may want to encourage them to speak with HR.
Okay, I'm going to talk a little bit about anxiety, right? And I think, like Krista said, depression is the sort of leading health challenge in the country and in the world. Anxiety is right up there, and anxiety and depression are quite linked. According to the National Association for Mental Illness, about 18% of the population struggle with anxiety disorders. There's a very strong similarity between the loss of productivity and sick days for people struggling with anxiety, and that very few out of the many who are struggling with this are actually receiving treatment. It's a costly condition, and people really do struggle with this, just like they struggle with depression. And it's worthwhile to note that we're not pathologizing, right, people for struggling with these things. Again, if we go back to our level set, these are things that anyone can struggle with. And in the context of COVID, there's a lot to be anxious about, right? I mean, people were unsure of basic things, like Krista said, like getting toilet paper for the house, especially back in like April and May. People were concerned anywhere from that to getting sick and not being there for their families, or concerned about older family members. You have a grandfather who's 96, who's living in assisted living in New Hampshire, and everyone's obviously really concerned about these folks for good reason. And then when that concern can turn to anxiety and impact your ability to do things the way you were doing it before, that's when it might be time to seek some help and support. You'll notice that anxiety, as manifested in the workplace, can look a lot like depression. It can be restlessness, just like depression. It can be difficulty concentrating, need for reassurance. And again, we're not pathologizing any of these things. Everyone can have a slow, tired day. It's raining out today. It's raining and cold, and and those are the kind of days when sometimes it's just hard to get going. People can be irritable because they didn't get their morning coffee, right? There's a lot of or they got rear-ended on their way to work. There's a lot of reasons why someone might be irritable. Doesn't mean that they're struggling with an anxiety disorder, but when you notice as an employer, as a manager, as a coworker, as a friend, people for whom these manifestations change, right? If it's a sudden change or a change that's happened, and then it's not just one tired day, it's not just one irritable day, but it's just become more of a constant thing, and that there's a change. That's when you might be witnessing someone really struggling with these issues, and it might be time to find the way to help support them if you can. To get some help and support. And again, that might just be removing the notion that there's a stigma in your workplace around these things. Krista mentioned that the HR department, we know not every local business has an HR department. Many people are the owner, the HR department, the finance department, personnel, payroll, accounts payable, accounts receivable. We know that there's people who are really doing everything for everyone in their business. And there's a lot of different kind of businesses, and difficulty concentrating means something a lot different to someone with a job who sits in front of a desk all day than for someone who's at the top of telephone poles all day, right? And so that the safety risks around someone who's struggling with anxiety and depression, depending on the kind of work that they do, or someone who's driving for a living, there's a huge range of potential outcomes and what it means to be less productive and less focused at work, depending on the kind of work that you're doing.
So we've talked about depression and anxiety, and of course we need to talk about substance use and how it affects our, employees and people in the workforce. And so 1 in 13 working adults has an alcohol use disorder. Remember, back to depression, we had 10%, so that's 1 in 10. So this is pretty significant. This is a pretty high number also. If you think about how many people that you work with, that 1 in 13 of them are struggling with some sort of alcohol use disorder. And then the numbers keep adding up when we're talking about other, substance uses. $74 billion is lost every year in reduced work due to absences and lack of productivity because of alcohol use. And that goes back to not just alcohol use, but also caretaking for people who are struggling with alcohol use. This is, absences, this is lost productivity, and like I said, caretaking. People with opioid use disorders miss over 18 days a year due to substance use. We have, I don't remember exactly, what did we say, 27 days for depression. Now we have 18 days for opioid disorder. And when we remember that chart in the beginning when we talked about co-occurring, so if somebody is struggling with some mental health stuff and some substance use stuff, that's going to increase the number of days that they are missing out on work and their lost productivity from work. So these numbers are really just to show you the significance of paying attention to substance use in the workplace and how important it is to help support people who are struggling with substance use. So some of the things that you may see, much like we talked about some of the things you may see with somebody who is depressed or anxious, you may see somebody acting out of the ordinary, calling out sick excessively, maybe especially on a Monday. I think we've kind of seen that in the past. Coworkers complaining that all of a sudden somebody is acting a little bit differently, increased sleepiness, rapid mood changes, maybe somebody nodding off or sleeping at their desk. And like Eric is saying, There's a big difference between, paying attention and kind of being distracted at a desk and on top of, an electric pole. And if somebody is nodding off in a dangerous situation, if they're a driver, if they're in a place where they're caring for others, in a restaurant, that can be very dangerous. Patterns of absence we look at, somebody who's smelling like alcohol. I know a lot of times people who struggle with alcohol use can, the next day, even when they're sober, may still kind of like sweat out that alcohol smell, and just things to kind of pay attention to. I'm sure you can think of things in your own businesses of experiences that you've had when you thought somebody was struggling.
Sure. So this slide kind of speaks for itself, right? We talked about what the struggle with some of these behavioral health challenges can mean for your business in terms of lost productivity, safety risks, absences, forcing other people to cover for those absences, or you to cover if you're the manager or business owner. So the other side of that coin is that receiving effective treatment, and support can alleviate symptoms and improve someone's job performance. And this goes not just for the employee, him or herself, but for the employee who's the caregiver, right? So if an employee's productivity has been impacted because of a family member, child, a spouse, parent, anyone else who they care for, if they've been concerned for their safety and concerned about their well-being and concerned about their functioning or their health, then they may have been less productive at work. They may take days off. If that person is getting the treatment that they need, then that person's job performance will more than likely improve. So the benefits, obviously, it goes without saying to say that therefore there's benefits not just to the person receiving the treatment, which is the number one goal, but also the benefit for your business. So what we would hope to see, and what we would see, is a sort of an easement of these financial costs for employers. As long as, if people are receiving the treatment that they need to, you're going to see less. We talked about like safety issues, job-related accidents. You would see reductions. You'd see less people taking sick days. You may get less turnover. People leave the workforce due to these issues. As we mentioned, the opioid epidemic has had a huge impact, like statewide, of about close to 3%. The workforce actually reduced, not people who are unemployed, but people who have fully left the workforce and therefore aren't counted as unemployed because they're not even looking for work. So people leave jobs for these reasons. They leave the workforce for these reasons. So we're going to see a reduction in that if people are getting the treatment that they need. You have people coming in to work the full amount of hours you want them to work, and when they're there, they're going to be more productive. And obviously there's other huge costs that are probably not calculated into here to having accidents in the workplace in terms of like insurance costs or lawsuits, or other health costs that could be an outcome of someone hurting themselves on the job, when that in theory could have been preventable if they were receiving, if the nature of the accident was such that it was related back to behavioral health issue in some way, then those costs would therefore be reduced if people are getting the treatment or had been getting the treatment that they needed.
So when we're talking about the benefits of treatment, we also have to talk about the new things that have been kind of come up in the COVID world. And I think one of those has actually been kind of like a great thing, which is access to treatment. And over the past 7 months, we as an agency have really kind of pushed technology and been able to help people get into treatment in ways that we haven't before. And, people, as I've said, people talk about not going to treatment because they can't, it's not accessible. It costs too much, the cost of transportation. We work in a little county, Putnam, and we're very grateful for the transportation that there is, but the county's kind of spread out. It's not easy to get places. If people are pretty far away, it's hard to get all the way into our little agency in Carmel to get to treatment. So digital technology has really increased. We call it telehealth, and we're able to help support people in, through phone and face-to-face, on a computer, on a phone, in ways that we haven't before. And when I think about, as an employee, being able to access treatment, now I don't have to take 20 minutes. If I want to get into treatment on my lunch break, I don't have to worry about the drive over to Carmel and, waiting for my appointment to start. I can schedule something right on my lunch break, right from my phone, and have that face-to-face or have that phone appointment and be able to talk to somebody. I think this helps people who are a little anxious about going into going into a building. Even within COVID, as I don't want to be around people. I don't want to go sit in a waiting room because I'm anxious about who else is in there. And from the safety of my own home or the safety of my workplace, right from my phone, I can now access treatment. Now there's digital technology has a ton of benefits. It's really easy. A lot of people have a cell phone. A lot of people have a smartphone. It's just easy to use. It's great not to have to get into the car and get somewhere and worry about how long, commutes and all of that are going to be.
Great. Yeah, I think one of the other things I would just want to add to that, but I don't know if we actually had it, is that if we can hope to see some positive outcomes to the current situation, like you're talking about, this access of the access for treatment to do with technology is one thing. This is also a shared trauma, right? That the whole community has had from your employees, your customers, your families, your friends. We're all going through what's happening in COVID. Even just, we talk about this in CoveCare Center. This is an example where our treatment staff, our treatment teams, are going through the same thing that our clients are going through. This isn't anyone's individual, everyone's having their individual experience, but it's a shared community experience. And in that way, to be struggling with it shouldn't be stigmatized. I mean, none of this should be stigmatized, but we're all going through this. And there's a lot in the media about sort of depression in the COVID world and about how to prevent anxiety for yourself and for your kids. And, there's a lot of discussion around that. And so a hope could be is that reduction of stigma around depression, anxiety, and how those things can come out of this shared collected experience. Hopefully this will overall reduce stigma moving forward, even in a post-COVID world, which we're all hoping for very soon. So what can you do? Right, and so this looks like a relatively small list, but one thing that you can do is to have literature and flyers of services, Putnam County resources around. Right now, obviously, you may have less people in your business, less employees actually coming to your sort of headquarters or place of business, depending on how you operate. But having these things available for your employees shows that the culture of your organization, however large or small, and whatever kind of business you have, if you have physical advertisements, or if you're emailing out things about resources in the community that include things like CoveCare Center and the support that we can offer to kids, and the support that we can offer to families, and the support that we can offer to anyone around substance use and mental health issues, that shows that the environment of your work is a place where these things aren't stigmatized, and where it's okay to reach out and ask for help and support. At a very baseline level, it's a very simple thing that doesn't cross the line into any HR boundaries, any professional, personal boundaries, just making sure that there's resources available to your staff and to your customers. Should you have the kind of business where people come in to get services, shows that this is an environment where these things are not hidden, where there's no stigma, and where it's okay to talk about them. You can encourage staff to seek those resources depending on your relationship and the way that you work with your staff. I think that those those kind of encouragements, even if it's not about a specific issue, like, hey, I noticed this about you this morning and maybe you should go seek some resources, but just more generally to talk openly about how it's okay to access these services, and to say, oh, I heard that CoveCare has these telehealth services now. You don't even have to leave your house to get some support if you ever were to need it. And when it's possible, you can allow your staff to have time to get treatment. You can offer people an extra long lunch break, let them work flexible time. If they need to, again, it might not be for their own treatment. Maybe it's that, they need to be able to pick their child up early from school, as the case may be, or to leave their remote learning early for the day, so that they can go to an appointment, or that they can maybe have an adult with them while they're having their telehealth appointment, depending on how that is. Offering people that flexibility to care for their loved ones as well as to care for themselves is something that employers can do. And then again, we understand that managers, HR departments, you may be the manager and the HR department. You may be everything to everyone in your organization. And you may also need to get outside HR support and or legal support around certain issues, depending on the level to which the behavioral health issues are impacting things in your workplace. But just to make sure that everyone kind of is aware of what the resources are and what the laws are and what the HR. We're not offering any HR advice here today. That's not my role. It's not Krista's role. But there are a lot of resources out there for you should you need them. So again, these are just things that you can do. And if we can attribute a lot of the lack of access to supports to stigma, then reducing that stigma is a great place to start, whether you're talking about how you do this in business, which is what we're here this morning to talk about, or just in your personal circles. Okay, so this is to just offer kind of generally what are CoveCare's services. So I can go through this kind of quickly. We've got about 10 minutes left here. I do see one question popping up in the Q&A.
And you kind of just already answered that question.
Okay, what was the?
It says, if somebody's acting differently at work as a manager, how should I address it? And I think just going back to the last slide, we really talked about helping people get into, just making it a safe place for somebody to talk about.
Right. Yeah. And making sure that resources, like if there's a place where resources can be posted and made available to everyone, if the concern is sort of directly addressing a specific employee, like, good morning, Krista, here's a flyer for CoveCare's resources, might not feel like the appropriate way to suggest that someone needs services. Making it generally available and making sure that there's no stigma as a barrier to someone's treatment would be a great place to start. So we do have, while we wait to see if there's any more questions coming in, we've talked a bit about our mental health services. We have a mental health outpatient clinic that's your sort of traditional mental health clinic that's gone almost entirely virtual in the last 9 months. I should say, actually, we did it in about 3 days during the quick transition of how we all worked during March. We serve kids. We have kids as young as 3 and 4 in our mental health clinic. We also have outreach program that sort of works alongside the clinic with seniors who can support people in the community who may not be able to get to our services even prior to COVID. We accept pretty much every insurance that operates in this area, which is not a short list. And we're licensed by the state, and which means that we do not turn people away for an inability to pay. So we have a sliding scale when indicated. It also goes along with our mission. We're here as the only not-for-profit provider of this range of services. We're not the only mental health clinic, but we're the only provider of this range of services, and we're a not-for-profit in the county. So part of our role and part of our mission is to make sure that we're here for everyone in the community, regardless of what their needs are and regardless of what their financial situation is. So we're going to find a way to work with you if you need this kind of support. Just saw another question pop up. Oh, have you seen more people reach out for services since COVID started? Krista, you're nodding. Did you want to respond?
Yeah, no, absolutely. I mean, we've definitely seen people reach out to services who haven't received treatment before and who have specifically said that telehealth services is something that they were looking for because of transportation. A lot of times because of transportation issues and time issues. And I've heard of people who have come to us for services feel a little bit more comfortable not being face-to-face to at least start. And that's of course not everybody. There are people who very much are, traditional, who, really want the face-to-face traditional, but for somebody who's maybe a little bit more anxious, I know in our pros program, we've had some people who have come in and feel a little bit more comfortable just kind of getting used to services through telehealth and not having to worry so much about getting out of the house so much.
Right. And so you mentioned the pro services which are here, which is sort of group therapy, group services, vocational assistance, right? And this is for adults who struggle with more so-called serious and persistent mental health challenges. So that's one of our other treatment programs. Backing up to the second column, we've got a substance use outpatient services. Again, we work with teenagers through seniors. We do provide medication assisted treatment. We're expanding upon those services. Currently, we're working on that. And like Krista said, just because we have a substance use clinic and a mental health outpatient services clinic doesn't mean that we don't work with people who could fit in either setting. We're just going to make sure that we put the services in front of someone that are the most supportive, depending on what goals they come to us with. We have family peer support and advocacy. This is a program specifically designed to support people, to support families who have kids with challenges and mental health challenges specifically. So this is parent support and family advocacy services. We have care management. I think most of us have experience navigating the increasingly complicated healthcare system in our country and in our state. And what care management does is it helps people navigate with significant health or mental health challenge, behavioral health challenges, helps families and individuals navigate and create a care plan to navigate that challenging healthcare system for people who may not have the resources to do that on their own. And then we're also looking into, while any of these services are available to anyone who is eligible to them, and to find that out, you would just basically call us, talk to the front desk and intake team to find out kind of what we can put in front of you that's going to help you reach your goals and help you work towards recovery. But we are looking to develop some services specifically to develop relationships with the business community and to help provide the kind of support that might help your employees get the treatment and services they need in an easy and convenient way. So there'll be more to come on that. We're working on that before the pandemic, and we're going to have to obviously shift gears to what that will look like, but that's hopefully in the works and coming soon. And just lastly, it's worthwhile to mention, if my slide deck would come through, is that CoveCare is, we are here to present this morning to the local county small businesses, but we're also a county small business, and we bring a lot of resources to this county. We operate with a budget of around $6 million a year, and going back to that initial calculus, that's $6 million that's invested in people's mental health and people's behavioral health, and therefore can increase health and productivity by $24 million in the county, and that's probably just a small estimate for the economic impact that we have to people who live and work in the county. We also have employees who live and work for CoveCare and live in the county. These are resources that if Putnam County didn't have CoveCare Center would go to surrounding areas where people went to get their treatment. And we also have really strong outcomes. Speaking specifically about our pros program, we have a very high percentage of the folks in that program who are, as a result of the support they get and the goals that they're working towards, able to work, able to attend school, and are therefore more likely to contribute to the local economy. So we have our own kind of impact on the county's bottom line, and we're really proud of that, and we feel like that's really important to mention. So we're sort of near the end here. I don't see any more questions. I want to just thank again our sponsors for helping make this possible. Krista, I'm so psyched that you were able to do this together. This was a lot of fun working on this and getting this, so thank you so much. Thanks to our attendees and those who asked questions this morning. We'll be doing our best to communicate with you afterwards. We'll post this online to make sure more people can view it. We thank the sponsors for their financial support. We are not-for-profit, and we do need your support now more than ever. What we were asked to do, we see an increase in services, and the short answer is yes. The people need these services more than ever, and that's not going to stop. So we're working to expand access and make sure that we can get people in to work with our team as quickly and seamlessly as possible in a way that really helps them work towards their recovery goals in the way that feels right for them. And we need support to do that. So we thank you for that. And I don't know, Krista, do you have any parting words for our guests?
Yeah, just if you have any questions, if something comes up later and you're like, oh, that was a point, you can contact us. Eric and I's, our email addresses are on our website. Come to our website, check out our Facebook. We're on social media, so there's lots of different ways of contacting us, and like us on Facebook, and you'll see as we put out events or just information, you'll have access to all of that.
Super. Thanks for that, Krista. Excellent. All right. Thanks again, everyone, for joining us this morning. Have a wonderful day.
Thanks all.